I have been losing weight on Zepbound. Go and tell him you want Zepbound because it's the best medicine on the market. Is that why you came to see me? She said, yes, doctor, I want to be prescribed Zepbound and nothing else. Welcome to your daily health briefing. I'm Dr. Albert Tackett. This show is here to help you navigate the complex U.S. medical system, one step at a time. Whether you are decoding a new diagnosis, fighting for a referral, or just trying to stay informed, you are in the right place. Let's get into the science. Amaya comes to see me as a new patient and found me because her cousin told her there is a doctor in Upper Marlboro who treats obesity and prescribes GLP-1 medications. I have been losing weight on Zepbound. Go and tell him you want Zepbound because it's the best medicine on the market. These were Amaya's own words. So I proceeded to ask her, is that why you came to see me? She said, yes, doctor, I want to be prescribed Zepbound and nothing else. And this led us, of course, into an episode today where we have to talk about the comparison between Wegovy and Zepbound, or better still, Ozempic and Mounjaro, or even better, semaglutide and terzapatide, because those are the real chemical names or scientific names for these medications. So let's delve into the science. Is it true that terzapatide is better than semaglutide? Before we answer that, just a point of clarification, because I know this is a huge source of confusion for patients, and I have another episode of the podcast dedicated to the nomenclature or to the names of these medications and how they came about. But for today's purposes, just remember, terzapatide is also known as Mounjaro and Zepbound. Semaglutide is also known as Ozempic and Wegovy. So for now, let's focus on the scientific names to clear or reduce confusion. So, clinical studies have been done and a direct head-to-head trial, meaning they did clinical trials comparing terzapatide versus semaglutide to see which one works better. In these clinical trials, people who were on terzapatide after 72 weeks lost 20% of their body weight. People who were on semaglutide after 72 weeks lost 14% of their body weight. So that is a 6% body weight difference between both groups. That is the science. Now, another study that was done with real-world data showed that, again, terzapatide performed better than semaglutide, even though the difference was a little smaller than that initial clinical trial. Because, of course, real-world conditions are not clinical trial conditions, which are usually experimental conditions, perfect settings. The real-world conditions are a little different. So that is where the science leaves us, that there is truth to the statement that Amaya made. But now, we have to get into the actual real-world data. How do these medications perform in real life? It is true that even in real life, as I just mentioned, in my clinical practice, terzapatide tends to perform better than semaglutide. Truth be told, I prescribe a ton of this medication, so do my colleagues here in this medical group, and we have realized that that is true. Now let's get to the part of the story that is most interesting. After 72 weeks, terzapatide users lost 20% of body weight, and semaglutide users also lost 14% of body weight. So both groups lost, right? Everybody lost. So let's translate that into real life. If you weighed 100 pounds and you lost 14% of your body weight, that is 14 pounds. And if you lost 20% of body weight, that is 20 pounds. So the most important takeaway is that both groups lost on the medications, right? And this is after 72 weeks. That's a long time. So I had to tell my dear Amaya that the focus on Zepbound versus Wegovy, Ozempic versus Mounjaro, is usually misguided. The most important thing is which one does your insurance pay for? Because these medications are expensive. They are. When charged to your insurance company, usually cost anywhere between $1,200 to $1,600. If you are going to buy it from the manufacturer's pharmacies, the NovoCare and the Lilly Direct self-pay solutions, they can run anywhere from $200 to $400 a month. So these medicines are not cheap, but they are very effective. And so the key takeaway is whichever one your insurance pays for is good for you. So this is where you have to work with your doctor, right? Again, patient-physician allyship, sorting through the issues and landing on the exact framing that we just got. The most important thing is, which one does your insurance pay for? And so when patients ask me that question, Doc, which one is better, Ozempic or Mounjaro? I always tell them the best one is A, the one your insurance will pay for, and B, the one you are actually going to use the way it was meant to be used. That is, you take the medicine and you institute calorie restriction. That is, you eat less, and then you add exercise and diet. Exercise including resistance training and aerobic activity as you go along. That is the correct strategy, because in clinical trials that showed that difference I just mentioned, the 20% versus 14%, guess what was happening? The patients were very adherent to the dietary restrictions and the exercise prescriptions of the clinical trials. But what happens in real-life data is that people don't do that. Many people take the medicines and just expect that, the medicines will work miraculously, and they fail and become frustrated. So let's shift our thinking and focus again on the most important issue, is that both medications are effective. The winner will be decided by you, the patient. The one you adhere the most to will be the winner. Because in my practice, and I prescribe a ton of these medicines, I have people who've lost 100 pounds on Wegovy. I've got people who've lost 100 pounds on Mounjaro. I have people who've lost 0 pounds on both medications. Okay? So don't be fooled by wild internet claims or anecdotal evidence from your cousin, your barbershop, or your hairdresser. Rely on the science and rely on sticking to the plan. Work with your doctor. Okay, so if there's anything to take away from this episode today, is that the debate, which one is better, Ozempic or Mounjaro, is pointless. The one that is better is the one your insurance pays for and the one you are committed to taking and using as prescribed. Okay? Remember, consistency is better than the choice of drug. I'll see you next episode, because the fight never stops. This has been the Daily Brief. Medicine is not about certainty. It is about responsibility. Decisions are often made with incomplete information, but they are always made with your safety in mind. In a system that can feel rushed and fragmented, you deserve clarity, continuity, and an advocate who sees the whole picture. I am Dr. Albert Taken, your physician ally, high-level science, human-level care. I will see you at the next briefing, or I will see you in the clinic.